afternoon, everybody. It is Tuesday, March the 31st. I am Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners, and I'm here with my colleagues, Commissioner Ken Lawrence and Commissioner Joe Gale, along with Dr. Brenda Weiss, Administrator for our Office of Public Health, and Dr. Al Wong, our Regional EMS Director. So since our March 30th press briefing, we have received notice of 58 new positive cases of COVID-19 in Montgomery County, which brings us to a total of 564. That's 564. These positives are from 29 municipalities, none of which are reporting their first cases. This keeps us at 51 of our 62 municipalities that are home to individuals with COVID-19. The individuals that are positive today range in age from 2 months to 78 years old. And you can see our county map found at montcopa.org/COVID-19 for updated geographic information. In terms of ages, today we have 3 individuals who are 0 to 9, 3 that are 10 to 19, 3 that are 20 to 29, 11 that are 30 to 39, 7 that are 40 to 49, 16 that are 50 to 59, 6 that are 60 to 69, and 9 that are 70 to 79. There are 28 females and 25 males. 1 is hospitalized, 11 are at home under observation, and 46 are unknown. I am also saddened to confirm that 2 more Montgomery County residents have lost their lives to COVID-19. The first individual was a 75-year-old male who resided in Horsham Township. The second was a 66-year-old male who also resided in Horsham Township in a separate residence. Both were in a hospital at the time of their death, and both had underlying medical conditions, and that is all the information that I have on these gentlemen. Again, we are very, very sorry and extend our condolences to the families and loved ones of these 2 individuals. All right, update on our community-based testing site. The site remains up and running. And thank you again to Temple Ambler, the Temple University Police, Upper Dublin Township, and the Pennsylvania National Guard Medical Unit, and the many county departments that are assisting to make this run. As of this morning, we have tested 2,364 individuals. That's 2,364. 62% of those results are back. 13% of those are positive. The site will be open from 10 a.m. to 4 p.m. tomorrow, Wednesday. Registration for tomorrow will open tomorrow morning starting at 8 a.m., either online or by phone. Online, go to montcopa.org/COVID-19 and click on County Testing Information. By phone, you can call 610-631-3000. I want to give you an update on the Limerick Generating Station in Limerick. Montgomery County leadership first learned about a long-scheduled maintenance operation at the Limerick Generating Station during a call with Exelon executives on March 16, 2020. We learned of plans to bring approximately 1,800 workers into our region from around the United States and southeastern Pennsylvania, who would stay in local hotels and eat from local restaurants and travel to and from Limerick Generating Station each day. We asked to see Exelon's pandemic response site plan. After several conversations with Exelon executives and others, we concluded that the plan was not adequate for the COVID-19 pandemic. We asked Exelon to postpone this refuel until a time when the disease burden from COVID-19 was lower in Montgomery and Chester counties. Exelon proceeded with the refueling pledging to commit to many mitigation measures, including social distancing at the work site. Today, our Department of Public Safety received notice that adherence to social distancing measures may not be occurring at the work site. Now that the refueling has begun, Exelon has the responsibility to speak to the public on this matter and answer the public's questions about the overall safety of this operation and the steps that Exelon is taking to protect the employees in the plant, first responders, residents in our communities, and the workers brought into the plant for the refueling, including whether or not they are following the steps they committed to take in the pandemic response site plan. We have communicated our concerns directly to Exelon. And with that, I'm going to turn over to Commissioner Gale.
Good afternoon, everyone. I am Montgomery County Commissioner Joe Gale. For the past few weeks, I have been talking about extending the county and municipal property tax discount period deadlines. We have encouraged municipalities in Montgomery County to extend their property tax discount period deadlines to avoid additional financial strain on families who have been economically harmed by the coronavirus crisis. I am pleased to inform you that many Montgomery County's 62 municipalities have agreed to extend their tax collection deadlines. On behalf of the residents and businesses in those municipalities, I thank you. Unfortunately, a few townships and boroughs have been unwilling to cooperate. I continue to urge them to extend the deadline. In an effort to further assist our municipalities, we have asked our legal team of solicitors to draft a template resolution that the townships and boroughs can use to extend the tax deadlines. The template resolution has been sent to municipal managers and tax collectors. This is just a suggested template that can be used, but is not specifically required. If townships have already passed or would like to pass their own version of the resolution, they may do so. Moreover, we are requesting that discount deadlines be extended to at least May 31st, but ultimately that is at the discretion of the municipality. We will be following up on this with all the townships and boroughs, and we will be compiling a list of those municipalities that have extended the discount period and those that have chosen not to. Thank you again to all our municipal partners. We will continue to find ways to avoid and reduce hardship on residents any way we can. Thank you very much, and I will turn it back to Commissioner Arbush.
Thank you, Commissioner Gale. So now it's time for my daily reminder on the importance of staying at home. I want to thank everybody that's staying home. I want to thank everybody who is making the least possible number of trips to the grocery store and to run errands and things like that. You are staying home to protect all the people that cannot stay home. All of our hospital and healthcare workers, our first responders, the people that are checking you out at the grocery store and at your pharmacy, and the people that are part of the supply chain to make sure that your grocery store still has food and your pharmacy still has medications. Remember that that's what we are doing. By all of us staying home as much as possible, except for the most important trips out, we will end this pandemic as quickly as possible. And with that, I will take questions.
Hi, I'm Wendy Saltzman from NBC 10. Can you tell me a little bit about what we're thinking in terms of the peak? When do we anticipate there will be a peak here if we continue social distancing?
The modeling that we've seen that looks the most accurate suggests that the peak will happen in the middle of April, sometime in the middle of April.
So with that being the case, what is your recommendation? Are you anticipating that businesses here should stay closed, that people should continue social distancing, and how far past that peak point?
So this is no time to relax any social distancing measures. Once the number of cases finally does start to come down consistently and gets down to a low enough number, which I would say is in the single digits, that we don't have to worry about our hospitals and our first responders being overwhelmed, then we still need about 2 weeks after that, because we know that anyone who's been exposed can take 14 days to show symptoms, and we've certainly seen that here in Montgomery County. with people demonstrating symptoms on day 13 or 14 after a known exposure. So we are looking at 4 to 6 weeks, I think, at a minimum from today. Assuming that peak happens when the modeling is suggesting that it will.
So what do you tell businesses who are looking at that timeline and concerned about their future and people with kids in schools? What do you say?
I have 2 kids in school that are sitting at home online, well, maybe not right now, but certainly earlier today. It's tough. We know it's tough. And I think we've announced at this press briefing every day a number of measures for small businesses and loan programs. There's been federal legislation now passed to help small business owners in particular meet payroll and things like that. The thing that people have to keep in mind is that if we adhere to these social distancing measures, this will hopefully be over in the next couple of months. If we don't, this could stretch on for the rest of the year potentially. So it's a question of ripping the Band-Aid off quickly, having a lot of pain in the short term, or ripping that Band-Aid off slowly and having pain that goes on for a very long time. So we're encouraging people to stay home now. Let's get this thing over with as quickly as possible.
I don't know who's best to answer this question, but we're hearing from first responders that they basically get one mask for the entire shift.
Well, as I've said many, many times over the last couple of weeks, first responders and hospitals are following the CDC guidelines for extending the use of personal protective equipment during a pandemic. So I'm not surprised to hear that.
And what's your message to the people who are doing that? I mean, that's obviously a strain on them. It's like, what do you say to them just kind of as they
We have been doing everything we could to get more PPE into our region. Like everybody else literally in the world, we are competing to get PPE. We have made requests to the Strategic National Stockpile, to the state, to others, and we just want to urge each individual person to be as careful as they can to make sure they are following all of those guidelines. Those guidelines are well thought out. In a perfect world, would it be this way? No, but we're not in a perfect world. We're in a pandemic with a crisis that no one clearly foresaw the extent to which it would take hold in this country. And we have to do everything we can to stay as safe as we can. And hopefully the measures that are being taken to increase the amount of PPE to our region will start to bear some fruit and we'll have more availability of those items.
We heard somebody from a caller that somebody in the county jail may have symptoms. If somebody did have symptoms, would they get tested, or is it a quarantine isolation system?
So we've talked about 3 correctional officers previously. You're talking about someone separate from that.
From an actual inmate. I'm
aware of one inmate who is currently in quarantine, who does have some symptoms and has been tested. I do not have the results of that test.
But they have been tested.
That's my understanding. And they are being isolated.
You mentioned the 2-month-old, and I don't know, you may not know that. Do you know the
I don't.
challenges?
In fact, we don't know. We've been unable to verify whether or not that individual is hospitalized. So all I know is the age.
And that seems like I mean, obviously it's the youngest that we've been talking about.
I believe that is our youngest.
Are there additional challenges can you address any of the challenges when you're dealing with the?
I have read very little in the medical literature about patients this young, so I would only be speculating.
And just to clarify, you said the 2 Horsham cases were separate households. Are they related in any way, or?
Not that I'm aware of. They were in separate households.
They're just same township?
I believe that's correct. Yeah. Teresa,
We have 2 questions from Allison Steele of Philadelphia Inquirer. You talked about when you thought Montgomery County would reach its peak in terms of cases. Governor Cuomo in New York said that their peak may be 2 or 3 weeks away. Seeing as Pennsylvania has been behind New York from the beginning in terms of cases, what can we infer from this? Does it suggest that mitigation efforts taken by Montgomery County are beginning to have an impact?
well, first of all, since you mentioned Governor Cuomo, he put out a call for medical volunteers yesterday to come to New York. And if you can hear my voice and you live in Pennsylvania, I'm asking you to stay here in Pennsylvania because we might need you. So please do not go to New York. I have not been keeping a close eye on the situation in New York, other than the big picture issues, which is that they are severely impacted by this pandemic and are in a situation of significant scarcity in some neighborhoods of New York City. As I've been saying from the beginning of this, since we got our first 2 cases on March 7th, our goal was to flatten the curve here. And we have been asking people to stay home. Our schools were closed by the end of that first week, and we have continued to decrease people's movement since then. I hope every day that we did that quickly enough, and that we will flatten the curve enough that we will not see ourselves in a situation comparable to what New York City is facing right now. And our hearts and prayers go out to everybody in New York City right now. We do hope that we are in a somewhat better situation, but it is still a little too soon to tell. We're really just on the edge of what we expect to be the peak of this disease here in our region here in the southeast of Pennsylvania. And we'll know more probably in about a week and a half when we see what the actual numbers look like.
Is the county concerned about the number of available hospital beds in the event of a patient surge? And are there contingency plans in place to address the possible hospital overflow?
We are planning for surge capacity should we need it for our hospitals. Montgomery County is part of the effort at the Glen Mills School in Delaware County to create some surge capacity there. We're also working here within the county to potentially set up another place for surge capacity. Nothing has been finalized, so I don't have anything to announce today, but as soon as that is finalized, we will absolutely make an announcement about that. Is that it? Great. Anything else?
Can you just expand on that in terms of what the plans are? You said you all are building other hospitals, or what exactly are you doing?
I can't. Until it's finalized, I really can't speak about any details yet, because the details could change. So I don't want to speculate on something that doesn't quite exist yet. All right, great. Thank you.